from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. We've been hearing the forecast of the potential for triple-digit temperatures, and we want to know, can summer heat raise your risk of heart attack? You might be surprised by how much. Joining us this morning to explain is Baptist Health cardiologist Dr. Scott Davis. Thanks for being with me today.
How are you?
Well, I'm great. Well, this is really interesting to start talking about this. Perfect timing to remind everyone to respect the heat, right?
Right. So a couple studies to bring to mind. There was a study done by the European Heart Journal, published in the European Heart Journal, looking at the correlation between heat and heart attack. And they started like in 1987 and went through like 2018, looked at a pretty robust set of data. And they found that with climate change, with increase in heat, there's a higher correlation of heart attack. And folks, we all know, look, man, you go outside in the heat, it's rough. You sweat a lot. But why does it impact the heart like it does? And so primarily because lowering blood pressure can then put, extra stress on the heart rate goes up. But there's more than just that. There is a direct heat component. And so the University of Michigan then also did a study around 2018 as well, looking at some 40,000 patients, and found then with increases in the fluctuation of the temperature in the day, there's a higher correlation of heart attack. What do I mean by that? Well, by increase in fluctuation in temperature of over 9 degrees during the day, there's a 5% increase. And so, for instance, James was just talking earlier how we're going to peak at 101 probably on Saturday, but there's going to be an over 20-degree swing in the day, and that can be associated with an increase of 15% increased risk of heart attack in that kind of a window. And so we really want to bring this to the attention of folks in the community about, look, heat has been proven to be an independent predictor or independent contributor to heart attack. And so, we want you to just be mindful of that. Look, we don't want you to stop exercising. We just want you to just kind of put your life on hold when it's, 110 in the shade. But we also want you to be mindful of, look, if you're going to exercise, maybe don't do it in the, in the peak of the day. And that's not always at noon. James will probably tell you it can be in the afternoon at 4 or 5 o'clock when it can get really, really hot. Go ahead and exercise first part of the morning, for instance, or do it later in the evening at, after the sun has started to set at dusk.
Sure.
But still be mindful of your fluid intakes and watching to make sure that you're taking your medicines if you have blood pressure medicines. And then don't start your exercise program in this season without at least touching base with your doctor first.
Well, that's some good information there. And eating, I'm sure, is an important part of that as well.
Well, yeah, you want to maintain your diet and be sensitive to that. But, I tell people, especially during the summer months, as far as fluid loss, right, you want to make sure you keep your tank full with water, not iced tea, not, diet drinks, but, with water, because just getting outside in the hot, you can have incidental fluid loss beyond something saturating your clothes, right? So really want to keep your volume intake up.
Well, some great stuff to keep in mind. Dr. Davis, thank you for joining us this morning. And you can contact Baptist Health if you ever have any questions. You can see their phone number right there.